Hi, my name is Robert Coplan and I'm a professor in the psychology department at Carleton University. I'm also the director of the Pickering Centre for Research in Human Development. I'm a developmental psychologist and my general research interests are in the area of children's social and emotional development and peer relationships. In particular, over the last few years, a major focus of my research has been on the development of shyness, social withdrawal, and social anxiety in childhood. Shy children tend to be nervous and anxious when they meet new people and feel embarrassed and self-conscious when they perceive themselves to be the center of attention. Shyness is quite stable across the lifespan, and extremely shy children are at an increased risk for experiencing later difficulties. For example, shy children may experience problems in their relationships with peers, they may have trouble at school, and in the most severe cases are prone to more significant mental health difficulties like social anxiety and depression. However, it's certainly not the case that all shy children go on to experience later problems. Indeed, a focus of a series of studies in my lab over the last several years has been to explore some of the factors that help explain why some shy children do better than others over time. So for example, we have examined the family environment, the role of parents, parent attitudes, parent beliefs, responses, disciplinary techniques, and emotional reactions to their shy children as an area that might help explain why some shy children cope better with their feelings of shyness. As well, we've looked at shy children's experiences at school with peers, the friendships that they form, the experiences that they have interacting with other children or not interacting with other children, the types of relationships that they form with teachers' attitudes and beliefs and responses to shy behaviors in their classroom. We've also tried to explore how shy children function outside of the school environment, looking at their experiences in play dates and in less formal peer contexts such as sports teams, extracurricular activities, those kinds of things. I guess the major goal of this research is to try to identify factors that would help shy children be resilient, help them do better in the face of the kinds of stressors that they face in their daily lives. And with that in mind, in the most recent research that we've been doing, we've been developing and implementing and trying to evaluate the preliminary effectiveness of some new early intervention and prevention programs for extremely shy children. In our research, we use a number of different techniques, a number of different methodologies. Graduate students and undergraduate honors thesis students who work in my lab are trained on interview techniques to do assessments for young children, for example. We also spend a lot of time watching children interact on the playground or in the preschool classroom, so students get training in early assessments having to do with observations, and particularly in naturalistic settings. Again, our primary goal, I guess, is to identify some of the naturally occurring risk and protective factors that help explain differences in shy children's outcomes over time, again, leaning towards the idea of developing early intervention programs. If you'd like to learn more about my research, I encourage you to visit my website, which is accessible from the main psychology webpage at Carleton. If you'd like to learn more about the developmental psychology research that goes on at Carleton University in the psychology department, follow the links through to the Pickering Centre for Research in Human Development, where you can read all about the research being done by the developmental group here. Thank you.